Breast lift, or mastopexy, is a procedure designed to lift the breast. But I always say it really should be called a nipple lift because it doesn't do what a bra does. It takes a breast that has either lost weight or had children or congenitally was somewhat saggy, and it predominantly lifts the nipple back into a perky position. It doesn't fill the upper part of the breast, but it can be coupled with a breast implant to fill and to lift. There are 3 different designs to it that are all based upon where is the extra skin. One of them is called a donut, and the resulting scar just goes around the areola if there's just extra skin around the areola. The second is a lollipop if the nipple needs to move up and there's extra skin across the breast, leaving a vertical scar. And then the most common one is called an anchor mastopexy or T-scar, where in the end, after repositioning, basically putting the breast into a smaller skin bra, there's an incision around the nipple, there's an incision vertically, and one in the fold underneath the breast. The scars are noticeable, but they're worth it. And part of our discussion is to say, how bad is the sagging, and can just an implant solve the problem, or do we need to remove extra skin? With that, we can remove extra breast tissue if needed. So sometimes we just take out some extra tissue in the lower pole and add an implant to give a more uniform and filled breast. Other times, the breasts are too large, and then basically it's a breast reduction. A mastopexy, breast lift, and breast reduction are all the same design, and then in each case, we take out the extra skin, wherever it may be, and extra breast tissue as needed. It doesn't matter if the breasts are uneven because what we draw is even, and then we take out whatever is necessary to make them even again. However, we have to say, and actually I say this with all the breast surgeries, we make sisters, not twins. The things that can happen that make us less than happy are most commonly where those scars intersect at the T can heal slowly. So instead of just being 2 incisions that heal, there's a little scab at the T that can take a few weeks to heal. And you know how when you fall off your bike, you get a scab and it falls off, and then there's a smaller scab and it falls off and there's a smaller scab. It's just a flesh wound, as they say, unless there's an implant, in which case we're concerned about the outside world bacteria getting in through that opening in the scab, and we'll tell you how to take good care of that. The surgery has the risk of losing some feeling in the nipples, and after the T-scar, it's probably not possible to nurse. There would be no harm in trying because the baby might get some colostrum, but most of the time enough of the milk factory has been disconnected from the nipple that nursing isn't effective after that. I hope this is helpful. I'll be happy to answer any questions that you have to help you get your ideal result.